nowadays, like Botox, Dysport, Xeomin, any kind of neurotoxin, we can use not only to treat fine lines and wrinkles. It's also good for rosacea. Let's say if you have like always like a little blush and redness to your skin, or large pores, or a lot of sebum production, like oily skin. Now like Botox treatments help a lot with this also, as well as hyperhidrosis. Not only the armpits, the underarms, also the hands and soles. It's a good treatment for somebody who is struggling with excessive sweating. Also, we can treat you, like let's say you wake up in the morning and you see, or you notice on your Zoom, when you do Zoom, you notice like you have wrinkles, lines, like crow's feet, you look tired, you look angry, you look mad. So we can help you with some kind of skin boosters, Botox, fillers, or other laser treatments. The difference between Botox, neurotoxin, and fillers are that Botox relaxes your muscles. Let's say you're thinking too much, or you're focused, or your muscle activity here in the glabella is very strong. So you will develop deep lines and wrinkles, and if you relax the muscle doesn't contract, so you don't have this wrinkle. So everything is smooth and relaxed, so you would look less tired, more rested, and never look grumpy again. You can get your frown lines, the most common, forehead, right? You can lift your eyebrows and you can make like cat eye look. With Botox, we can treat your crow's feet, we can treat the bunny lines, we can do a lip flip with the Botox, just a little tiny bit to open up your lips more. Or if you notice like you smile and your lip is disappearing, so this is a muscle activity which kind of makes your lip invert inside, so we can relax your upper lip or lower lip muscle, and you will see your lips when you're smiling. We also treat marionette lines with some neurotoxin. We can also treat gummy smile with neurotoxin. We can lift the tip of your nose up. We can make your nose like smaller, thinner, and even shorter with botulotoxin. Also, we can treat the necklines and jowls, like with the platysma. With like when you treat all this area, we can do the chin dimpling, like chinulite. We call it so the chin dimpling. We can treat migraines, we can treat the tension and pain in the neck area. We can treat this like hump at the back part of your neck. We also can treat the bruxism, like and the side effect of this treatment, like kind of side effect also is face slimming. So we can make your face slimmer in this area, in this part, with the botulotoxin treatment. Also gummy smile. When some people smile, they have a lot of show to their gums, so it's easy to treat with Botox. We can even treat the hypertension in your calves area. Some people have anatomy of like building so much muscle in that area, which they don't like, so we can treat this as well. Before your first Botox injection or any kind of injectables, I would highly recommend you to avoid aspirin or Advil. You can take Tylenol, but if your aspirin or any kind of blood thinners are prescribed by your doctor, please get consult from your doctor, but it will increase risk of bruising and swelling. Also, don't recommend to get any treatments done if you had a lot of alcohol the day before, so please avoid alcohol 24 hours before and 24 hours after the appointment. So you have to be healthy on the moment of the treatment. Make sure you don't have any inflammation in your body, no sinus infection, no cold, no flu. So make sure you're healthy, you don't have fever, and after the Botox injections, any kind of neurotoxin injections, we recommend you to keep your face straight for the next 4 hours. No makeup 24 hours. Don't lay down for hours later, and the few first nights, don't sleep your face down to the pillow. No facial massages for 2 weeks. No facials for 2 weeks. No strenuous exercise. No yoga. No Pilates. No sport for 24 hours after the injection. No hot tub, no swimming pool, no sauna for 24 hours post-treatment. Also avoid alcohol for 24 hours. So let's say you get your Botox done today. So after 3, 4, 5 days, you will start notice the difference. Some clients notice that the next day their muscles are more relaxed, but the full results you will see in full 2 weeks. The botulinum injections are the dose is dependent on your strength of the muscle. I cannot give you the fixed price for that because everybody is different. It's all custom made protocols. But for your forehead, let's say your forehead and frown lines, it would be about $390 average. Sometimes it's less, sometimes it's more. For your crow's feet, it's usually like average is about $160. But again, if it's preventative dose, it's much less. It's about $150 for the crow's feet. For the lip flip, it's $150. For, let's say, chin dimpling and like prevention of marionette lines, it's about $150. It's about 10 units. And also for your jawline, for the face slimming or bruxism, we always start with a minimum dose, so it would be about $390. Also, the price is depending on the muscle strengths, of course. That is how we decide how many units you need. But also the price depends on the injector's experience and knowledge. So for more experienced injectors, the price higher than for somebody who is really good in what they're doing, but they just started recently. When you're looking for your injector, make sure your injector knows anatomy really well. They have somebody, even if they're new, it doesn't mean they're not a good injector. Sometimes new injectors are much better than the old ones, which don't develop their skills and they don't learn. Let's say here at Sparkle, we have new nurse injectors, and they're amazing. They had hands-on, lots of training, lots of practice hands-on with experienced injectors, and they always have support. They can ask questions. We are always around here to help and make sure they're knowledgeable. Don't shy to ask questions, and you will feel if your injector answers your questions with confidence. Let's talk about how long neurotoxin lasts. It depends on your own metabolism. The average is 3-4 months. It's by label. But I notice in some people it even lasts up to 1 year. For some people it doesn't last more than 2 months. So average is 3 to 4 months. Okay, so how long does the appointment last? So we always start with a good consultation. We never in rush. We take our time for a good we are taking good care of our clients. So we provide consultation about the botulotoxin treatment for you, if it's the right treatment for you, if it's we discuss like all other options and like good skincare for you, and the treatment itself is not very painful and it takes like about 5 minutes, so fast to inject. For new clients, we always do 2 weeks follow-up after your injectable treatments to see how your muscle takes it. So I prefer to go with low dose. I would never over-inject you at the first treatment. I would better inject some less and then to do follow-up in 2 weeks, and we can always adjust the dose for you. But yeah, our goal is to make you look younger, less tired, more rested, and you're not frozen. You look natural, but at the same time you don't have any deep lines and wrinkles. That's why we do follow-ups. About the pain, no, Botox doesn't hurt too much. When we do lip flips, we freeze you for a couple minutes because it's more painful, but usually it's like a mosquito bite, it's not. If you're preparing for any kind of event, like let's say wedding or birthday party or conference or any kind of event, please make sure you come 2-3 weeks before, at least 2-3 weeks before your event. We highly recommend you to get all the treatments done 1 month before your important event. I don't mind the baby Botox because it's a good prevention. I like baby Botox for young girls who already start to develop lines and wrinkles, and or for those who are actors. I have clients who are actors and they need to perform, and people have to see their facial expressions. We do baby Botox just to relax their muscle a little bit, but not to freeze you. I don't believe there is something which would replace botulotoxin treatments to relax the muscle, but yes, if let's say you already notice you have signs of aging, lines, wrinkles, but you're so against of Botox or Botox is not for you, we can help you with good skincare products you can use at home, and it will help you with the quality of the skin. Medical grade skincare has a delivery system which lots of people, scientists work on it in the laboratories, so it goes like to the dermis or to the deeper layers of your skin, which pharma lines, what you can buy at Shoppers Drug Mart or Sephora, they're sitting mostly on the surface of your skin, and they don't go like deep inside. The contraindications for botulotoxin or neurotoxin injections are for sure pregnancy and breastfeeding. Also, any kind of inflammation in the body. If you're sick, if you're having a fever, we're not injecting any kind of botulotoxin. Also, some neurological diseases can be absolute contraindications. Some vision diseases, some vision issues, like not like just you wearing glasses. No, it's just some diseases can be absolute contraindications for them. Botulotoxin injections close to the eyes. All other areas are fine.